Sorry, I was on mute.
So you should have a message now to say that we're going live on YouTube.
Brilliant, fantastic stuff. Should we just give Margaret a couple of minutes?
You should have a message now to say that we're going live on YouTube.
Brilliant, fantastic stuff. Should we just give Margaret a couple? Very disconcerting to hear myself just then. Is Margaret on yet?
No.
Okay, well, we'll kick off anyway, and hopefully she can join us in a minute. So welcome all. Welcome to this to our quarterly public meeting. We all know each other, so I won't do introductions.
Sorry, Ben. Can we do formal introductions just with us being live streamed, just so people?
Oh yeah, sorry, yeah. Oh, yeah. Good idea. I do apologise. Yeah. So I'm Ben Greenwood. I'm the interim chair of Healthwatch Rochdale.
Thanks, Ben. I'll go next. I'm Kate Jones. I'm the Chief Exec Officer at Healthwatch Rochdale. Rob, would you like to introduce yourself, please?
My name is Rob. I'm the Company Administrator at Healthwatch Rochdale. Over to you, Naomi.
Good afternoon, everyone. I'm Naomi Kenyon, the Volunteer and Involvement Officer at Healthwatch Rochdale. Karen?
Hi, everyone. I'm Karen Callendon. I'm the Chair of the Patient Advisory Group here at Healthwatch Rochdale.
Mark?
I'll go next.
Yeah, I'm David, yeah.
I'm David Bradshaw. I'm the Treasurer of Healthwatch Rochdale. And I guess it's Mel next.
Hello, I'm Melanie Tunney. I'm a Healthwatch board volunteer.
And finally, Rosemary.
Hi, I'm Rosemary Nunwick, and I'm also a board member.
Thank you. And we have got another member in with us, joining us today, which I believe is our new advisory group member, Moira. So thank you for joining us, Moira. Do you want to introduce yourself?
Hello, everybody. I'm Moira Oxenoni, and I'm new to Healthwatch, and I've just joined the advisory board.
Okay.
Thank you.
Thank you, Moira, and welcome. Okay, so that's all the introductions done. So let's proceed. The presentation, we were going to have a presentation today. Unfortunately, they've cancelled quite late on, so we didn't get a chance to replace them. So the meeting should be a bit shorter than it normally would be. Kate, have we had any questions from the public?
Nothing received, Chair.
Okay, thank you. Moving on to the minutes, I'll take them as read, but we'll go through them first for accuracy, then matters arising. So in terms of accuracy, everyone happy with them? Yeah, and any matters arising that are not on the agenda? No. Good. Any declarations of interest for anyone? No. Okay. Excellent. On to the action log. Kate, if you just want to very briefly go through anything that you want to pick out.
Yeah, all actions complete, none picked up from the, there were no actions from part 1 of the last June board meeting, so that's nothing to report on there, Ben.
Excellent, brilliant stuff. We're we're going through this very briskly, aren't we? Excellent stuff. On to work plan report, verbal update from you, Kate.
Yeah, thank you very much. So in regards to the work plan update, I just wanted to give you a bit of an idea of what's going on operationally at the moment. Obviously, you're all aware that Tracey Copeman, our engagement coordinator, has left the business, and therefore obviously that leaves us an engagement worker down. We've just got back out on the ground, so a few things have had to be jigged around in regards to the work plan for this year. So I just wanted to give you an update on that in regards to what we're looking at changing up slightly. So firstly, the first thing that we're going to look at doing is dropping the interim views. So our interim views were to go ahead from October. There's a couple of reasons why we've chose to completely drop this work stream. The main reason being is we have got no data in regards to the care homes since COVID lockdown. So previously our interim views were so paramount to our work because of the amount of care home data that we was receiving. Like I said, we've got no data. I have discussed this interim view work stream with Adult Social Care, who obviously sit as the commissioner as well in regards to the Health Watch contract. And what we're looking at doing there is doing some engaging differently. So rather than going in and engaging straight away as an interim view, actually engaging with residents and service users in a different way. So that's something that we're going to pick up in the new year. So the interim views are going to be cancelled for this financial year, but we will still be doing some engagement around the care homes and the service users over there. So that's the first area. Has anyone got any questions on that particular point? No. So the audience with, I've been up and running and we've run 3 sessions so far. We were meant to have one this evening. Unfortunately, that's been cancelled due to no uptake from the general public. So that has been cancelled. We were due to continue them on throughout the rest of the year. However, they are going to be rescheduled and they're not going to run monthly for the rest of the year. They will run bi-monthly. So there's some key topic areas that will be taken to the advisory group to discuss, to look at what those audience with need to be moving forward around the data and where we could best educate people. So that's something that will be taken to the advisory group next week. So we won't be running the original, I think we had 10 planned. There will be slightly less now. The advisory group will run as normal. The GP work stream will run as normal, and majority of that work's been complete, and you'll get a full prep update on the presentation in that. The mental health reports that have been completed have been sent to the partnership, so that will continue as normal. Some of the actions, some of the meetings that we tend to attend, which we'll put on the back of our work stream plan for this year, will need to be rejigged. And we'll be requesting some of our volunteers and board members to support maybe in some of those more localised meetings if there's availability there. Like I said, information, advice and signposting will go ahead as normal, and we are keen to get out and engaging just as much as we was before, but those areas of the specific work stream will be changed. And the other thing is that I will now be the accountable officer for the advisory group, in the managing and leading of it, whereas obviously that used to sit with under Tracys' role. But that will stick with me now moving forward. If anyone's got any questions on that.
Thank you, Kate, for that comprehensive update. As Kate says, is there any questions, comments?
Only how are we getting on we are going to recruit a replacement, I assume.
Yeah, so we're hoping to go out from the 1st for Friday for recruitment. Yeah, right. So it's not going to knock our work plan off that much. It's just that some of the timeframes have been pushed back slightly, so that we're not picking as much in November and December up, and it's pushing more into the final quarter of the year.
Okay.
Okay, thank you. Anything else? No? Okay, thank you very much. Thanks for that update, Kate. And now it's on to the staff presentations. Presume, Rob, you're going to be sharing a screen.
Do you want to send? I think, Rob, if you just make me host, I've got it up right now.
All right. Okay. Thank you.
Hopefully you should all be able to see this now.
Yeah, you can see it. That's great, thanks.
Okay. So the first part of the update was obviously Tracys' update, but Tracys left the business, so I'm just going to talk through this particular piece. So work stream 1 is GP practices, and this is the audit review on all the websites. So all the website reviews and reports have now been completed. So what's next on this piece of work? All the reports will be sent to the advisory group for a review, and they're due there next week. Then the reports will come to board for final sign off, and then they'll be sent over to the individual providers. The reports are also going to be sent to the CCG, and we're going to work with the CCG to create a new audit template for the websites. And then there'll be a re-audit by volunteers in January time to see what uptake the GP practices have made to their website and the changes recommended. We're also doing some work around the patient participation groups and engaging with them. And that's something that Tracey was leading on with Karen Kelland, our advisory group chair, who's on the call today. And that's something that we're going to continue to plough on with. So community mental health, there was a delay in regards to the survey going live, and that was just due to making sure that we engaged with the system around what the questions were. So we've got 2 surveys. We had the adults and children and young people. The surveys are now closed, and the data is currently being reviewed by the staff, and that's due to be published on World Mental Health Day. We'll be getting that report out. So for anyone that participated in the survey, there was a £50 prize draw if they left the information, and that winner is going to be announced at our volunteer event, which is happening on Wednesday, in which the mayor will be attending. So what's next with the community mental health work? So as I said, we're analysing the surveys. A mental health feedback campaign is up and running, and we're looking at getting more feedback and more specific case studies around mental health and access to services. And then there's a second part to the survey, which will run from January time. In regards to our information, advice and signposting, these sessions have been booked in. We did have to cancel some in September. However, they're all up and running, and the current engagement around our information, advice and signposting have been, we've shared that between us as the team, and these will all be attended. So an audience with, as I stated, we've had to cancel our one in September, and that was going to be around the Alzheimer's Society. We had a really good turnout at our last one, which was in June, for the carers, where we had 11 members of public attend. So like I said, we are going to look at different dates for these and a couple more sessions to run, but we do want to look at what our feedback is showing us. So GP session is a definite. We know there's a lot of misconception and some information that's needed for general public around access to GPs and what's available within pharmacy. And also dentistry is a bit of a buzz topic at the moment, so everyone can put something on the agenda there for them. But like I said, that's a discussion that we're going to have with the advisory group. Advisory group, obviously I apologise because the reports haven't been sent over for the advisory group because it's a verbal update, but we'll make sure that all the minutes and action log and decision log are sent over. We had one piece of escalated work still, which is just the moving on. Ongoing piece is still the ear care service, and that's been picked up again with the CCG. We seem to have hit the wrong person, the wrong point of contact. We had a development session in July, which was really successful. We had some really good conversations, and on the agenda item for the advisory group, I'll give you a further update there, where we're going to be looking at the frequency of the meetings and how we can look at more members. So the Engage project, this is a commission piece of work by the CCG, and the aim of the project, so I'm just moving my screen, is to improve access to health care and wellbeing support services for refugees and asylum seekers. So where we're at the moment, the survey's gone live, and we are currently just pushing that out through our comms to try and get us far and wide. It's both a professional and service user survey, so there's 2 different surveys that are up and running. And like I said, we're working with RADAG on that now. The next step, sorry, that's a typo, to attend the refugee and asylum seekers meetings, that's not happened yet just because of the delay in their meetings, but we are on the agenda to attend and give those updates once they're back up and running. There has been some slight delay in this project, and that's just been purely due to the fact that engagement hasn't been up and running, and we've had to wait for everything to get going again. But this is the next piece of work, and Naomi will hopefully be picking this piece of work up in Tracey's absence. So sorry, it's me again, because Claire is in the office today. So information and communications update. Has anyone got any questions before I go on anything that I've just given an update on? I'll take the silence as a no. So comms updates with regards to the website. In this quarter, we've had 2,743 visits to the website, and that is a 15% decrease on the website since the last quarter. So we've had 2,196 users, and again, that's been a decrease since the last quarter. The average session is running at 1 minute 19 seconds, and I don't know if that stat must be wrong because it's repeated, but we're saying there's a 21 increase, so it must have been higher than last time. So we have our top pages that are visited are our home page, feedback pages, and news articles on COVID testing. So in regards to the acquisition is where let me get this right. The acquisition is how people come through to our sources, whether that's our website, and it's showing that 1,120 came from an organic search. That's actually typing in Health Watch Rochdale. 852 came from that typing in Health Watch Rochdale. 1,120 came from typing a search engine in Google, and then 734 came from people hitting on our social media links and taking them direct to the website. Got there in the end. So how's our social media looking? So our Twitter, we've had an increase of 11 followers, taking us up to 2,037. We've had 247 tweets, 123 likes, 140 retweets. Our Facebook, we've had an increase of 23 since the 1st of July. 251 posts have gone out there, 20k link likes, and our Instagram, we've got a total of 570 total followers now, which is an increase of 20. We've had 60 posts go out, which is a key area for us. We're really trying to improve our Instagram to engage with our youth and with our MVP members, because they seem to be really keen with the Instagram side of stuff. So some figures there. So in July, we had 3 press releases, and all 3 of them were published in Rochdale Online. In August, again, another 3, and 1 of which was published. In September, we had 1 press release, and 1 was published on Rochdale Online. So I think it's really good that we're getting that local message out there through local partners. So in regards to feedback that we've received throughout the last quarter, so feedback, we've received 93 pieces of feedback in total, 57 of them which are negative, 22 positive, 1 neutral, 9 mixed, and 2 unclear. So in regards to signposting, so we've signposted 129 people to various organisations across the health and social care arena. 52 of them were to Rochdale Advocacy for further support or formal complaints, 20 to the NHS England Customer Contact Centre, and 14 to the CQC. And how we've received various pieces of feedback: 20 via email, 22 via telephone, and 55 via our website form. So I'm going to start talking now. I'll take any questions before I do, and hand you over to Rob. Has anyone got any questions on the comms? No. Rob, do you want to?
Lovely, thank you very much. Could you click on to the next slide, please?
Yes, sorry.
Thank you. So I'm just going to give you a quick update of the impact tracker over the last quarter. So over the last quarter, we've worked a lot more closely with the CQC, and we've forged a new relationship with the contact there now, who we can farm out their details for anybody that's got any queries. We've got a direct contact there instead of a generic email address. We've submitted a number of reports over the last quarter. The most recently in how local people want to receive information. This was shared with HWR CCG, the governing body, Patient and Public Engagement Committee, and the Quality and Safeguarding Committee for further consideration. We've also successfully raised safeguarding concerns for 3 vulnerable residents in the borough. So on to individual impact. A resident contacted us with a complex health condition, but was unable to get more information on the internet to make an informed decision about their COVID vaccine. We as Health Watch contacted the local CCG and in turn put them in touch with the appropriate healthcare professional, and they were able to discuss their complex health conditions in order to have the vaccine. The next was a patient who was awaiting cancer prevention treatment. So in order to receive this treatment, they had to have a number of dental works completed, and they were unable to obtain an NHS appointment for a dentist. So we made contact and managed to get them an appointment, and now they're having their cancer treatment, which is great. I was contacted locally by a child's mother who was unable to get an EpiPen for her son. And with our advice, they were able to get an appointment, and the EpiPen was prescribed within a week. Up until that point, she was unable to get a repeat prescription for it for one reason or another. We had a patient who was deregistered with their GP and was unable at the time to get a COVID vaccine. They couldn't find a local GP to register with. They contacted us. We contacted the CCG, who then got her registered, and the COVID vaccine was administered shortly after that as well. We've received quite a number of feedbacks on menopause resources. There seems to be a lack of it available online and in pamphlet form. So we've now collated some useful resources, and it's on our radar as well. So it just shows that we're reaching parts of the community, whereas previously menopause was not of key feedback for us. Next slide, please. So the main source of negative feedback still remains around NHS dentistry. People are still being offered private appointments, but people aren't able to register with an NHS dentist. We have been liaising with the local practices and GM Dental for regular updates and to aid us with signposting. We are aware it's a nationwide issue, so it's not just specific to the Rochdale Borough, but we are assured in the background that progress is being made. The next negative piece of feedback tends to be around face-to-face and routine GP appointments. So whether that's blood tests, blood pressure appointments, people are still struggling to actually get through to their GP, and when they do, all of the appointments are gone. We're still receiving low response rates to follow up. So any feedback that we receive and we have contact details for, we do follow up with to ascertain if the signposting that we gave to that particular individual was successful. We're still in the region of about 1 to 3% feedback that we receive. So it's still very, very low. So it makes it more difficult for us to ascertain the impact that we've had on that individual. There still seems to be locally a lack of awareness of local services and resources. So we are working with Action Together now, and I'll discuss that in the positive feedback. So signposting seems to be successful I'm still on that same one, sorry. Success with signposting, where residents have been able to resolve or obtain clarity on their query. We've now been added to the Action Together signposting spreadsheet, which is sent out weekly in the borough. It promotes Health Watch Rochdale further to a wider audience, which in turn increases the awareness of Health Watch. The awareness of Health Watch Rochdale is reaching into areas of health and social care. So as I mentioned previously, we've received feedback now from menopause and from trans residents. So we're obviously out there a little bit more with residents in the borough. And since COVID rules have been relaxed, we've started to receive a lot more positive feedback. Whereas throughout the pandemic and COVID, everything just seemed to be negative. We're now receiving some kind of positive news as well. So that's great to hear. Thank you very much.
Thank you.
Next, it's over to Naomi.
Thanks, Naomi.
Yeah, thank you, everyone. Next slide, please, Kate. We've had a really busy couple of months with the Rochdale and Oldham Maternity Voices Partnership. So we've had the remunerated chair in place since the end of May 2021. Her name's Leona Barlow. Like I said, we've had a really busy few months. We've continued to network, we're building up involvement, potential engagement opportunities right across Rochdale and Oldham. It's ensuring that we're building the profile and raising awareness of the Rochdale and Oldham Maternity Voices Partnership, and also giving opportunities for service users' voice to come in and to share our feedback link to different organisations as well. The Health Watch Rochdale Comms Coordinator Claire produces a monthly maternity services feedback report that she then shares with the chair, who then shares with the Director of Midwifery, and they're looking at like trends and lots of negative feedback and other bits and bobs, and also the positives what are coming in. The chair actually meets regularly with the Director of Midwifery at Royal Oldham Hospital, Simon, and she's also involved with the Greater Manchester and Eastern Cheshire Maternity Voices Network, and they're looking at regional things such as Ockenden Report, dentistry within maternity, and also around better ways of information sharing, looking at infographics and seeing how we can post better data across our social medias. We've been in attendance at a variety of meetings, for example, the Action Together Family Grassroots Gathering, the Rochdale Parent and Infant Mental Health Monthly meetings, smoking and pregnancy awareness, that's with the specific smoking midwifery team. And it's all around making sure that we can introduce the Rochdale and Oldham Maternity Voices Partnership, and just looking at how we can make potential links and just see how we can, share things with our service users as well, and how we can potentially gather feedback in around them specific services. In July and September, we had our meeting 2 and meeting 3, so the first one were in June, and they've been really successful. We've held the last 2, the July and September ones, via Zoom, and they've been really, really well attended by a variety of service users, commissioners, health professionals, and relevant organisations that we class as people who have service user representation, because they have the things like baby yoga and stuff like that. We really want to build up more service user participation in the meetings though. The next one isn't until January 2022, and we've sent out a bit of a questionnaire to all our contact list for the maternity voices, just seeing how we can potentially get more service users within these meetings. So it might be by changing the time, it might be making it an actual physical venue rather than it being on Zoom. So we're just looking at a variety of different ways. Also being mindful that across Rochdale and Oldham, we want to ensure that we've got, a mixture of both boroughs. We've done really well with our social media channels, and they're a lot more active now. They're all, especially our Instagram seems to be really, really busy. And it's also helped by being part of local campaigns. So we're part of the Patient Safety Day, which ran things all throughout the week, with the themes being safe maternity and newborn care. We worked alongside Rochdale Connections Trust and some other organisations to share information, raising awareness around fetal alcohol spectrum disorder, and that was through this month of September. And also this week it's the icon, so it's about raising awareness that it's okay to leave your baby to cry, and that's working in partnership with the Rochdale Borough Safeguarding Children and Young People team. Our social media handles are added at the end, and a slide at the end, so please do like, follow, share and all that, so that'd be brilliant. Next slide please, Kate. One before that one. Thank you. So next steps. So our next steps include a second recruitment drive for volunteer advocates. We've had a really, really successful first recruitment drive, and we've now actually got some advocates. We've got some volunteers on board who are all really interested in maternity services. They're very, very passionate. They're from across Rochdale and Oldham. I think we've got 7, and we've just put out for our second recruitment drive. The ones that we've got have all had an induction, and they're just waiting to take part in things now. We're looking at our next quarter's work plan on engagement. One of the things that they're going to be doing is 15 steps. So basically it's the first 15 steps as you walk into somewhere such as the antenatal clinic at Rochdale or at Oldham, and it's your first impressions. It's like, so it's all about your feelings, what you see, smell, hear, everything like that. Then you make recommendations on that. So we're quite excited to be doing that, because I don't think one's been done for quite a number of years from even from the previous Maternity Voices partnership. So they want to do a lot of on-the-ground consultation, and that includes the Baby Bubbles project, working with Bernardo's, Rochdale Connections Trust and Home Start, and that's engaging with seldom seen and heard communities across Rochdale to gather service users' voices. And we want to also ensure that there's trusted information shared, because a lot of the things that we're finding is that there's lots of just strange things being shared really across social medias. So we want to make sure that things are trusted information, especially around the COVID vaccination for pregnant ladies and breastfeeding ladies and family people, and also about informed choices. And we also want to look at building up a breastfeeding directory, and them 3 things have mainly come from the last 2 meetings. It's what's a regular topic of conversation, it's regular things that we get inquiries about, so that's one of the things that we really want to boost up a little bit more. Next slide please, Kate. And them's our social media handles, so thank you. Now my next one is our update on volunteers, so next slide please. So Youth Watch is our first stream, and we've really been massively concentrating on Youth Watch over the last few months, majorly trying to build up contacts across the Rochdale Borough. And since schools have returned in September, it's massively opened up further paths for engagement and involvement. We've transferred the Youth Watch application form, on saying we have Claire, our comms coordinator, as into a web form. And that's been massively successful. I was sending out literally recruitment packs as like Word documents, and we weren't getting anything back. As soon as we've done it as a web form, we had interest immediately in it. So I think this is the way that we need to go with especially our young people with volunteering, is the web forms. So it's massively raised their interest in Youth Watch Rochdale, just by having that web form for ease of use. It's going to be our Youth Watch is going to be further supported by involvement with approximately 5 different educational establishments in the Rochdale Borough. Initially, we're going to go in and talk to them and try and gather feedback, look at themes and trends, and also just see what the views and opinions are. We've got quite a few schools who are already interested. We do continue to meet at the moment the second Tuesday of every month via Zoom. And from these last few meetings, the massive themes around for young people have been the COVID vaccination for young people, dentist, orthodontics, and mental health, especially around exams and expectations, with huge waiting lists for young people. We have, with the COVID vaccination, we have been in touch with Phil Burton, who's said that he will quite happily go into schools and give assemblies and things like that for the young people around the COVID vaccination. Our other stream of work that we're looking at doing is the Youth Watch 100, which will go live in October. We pushed this back just due to the summer holidays. Before the summer holidays, schools weren't open. Young people were not in the mindset to do anything like this. They were really, really busy with schoolwork, catching up proms and things like that. So we're looking forward to how the Youth Watch 100 will be. It's young people, 100 young people signing up to take part in monthly surveys around certain trends, what will come back in, and we'll get a live draw every month, and somebody can be in with the chance of winning a voucher. So yeah, but we've also been involved with, we've been at Hopwood Hall for Freshers Week in Middleton. That were interesting, so that were really good as well. It was just nice being back out face to face and just talking to young people. We've had the mental health survey for children and young people, which we got quite a good bit of response back. And also we've been invited to star in and script a young people's mental health video. Some of the young people weren't too keen on that, but we're looking at further ways in which we can do it, maybe around animation. That's working with Rochdale Council and some of the mental health services such as #Thrive. So next slide, please, Kate. So our volunteering involvement, we have got quite a few opportunities still available at the moment for Health Watch Rochdale. We're still recruiting for a chair for the board. We've now got one more advisory group member, welcome Moira. So we've got 6 in total. We're still recruiting and keen to have a representative from Littleborough Harewood. Now that we're being able to get back into places a lot more, we can get back on the ground and get engagement a bit more. So we'll be targeting the areas of Littleborough and Harewood with that. The Youth Watch recruitment is now live. And we're, as I said before, we're going to be looking at signing people up for the Youth Watch 100. And as Kate said previously, the enter and view work stream is currently on hold, so we'll pick that back up at a later time. Next slide, please, Kate. And highlights, we've got some really good highlights. One of our best highlights is going to be tomorrow. We've got our volunteer thank you event at the Flying Horse Rochdale. Really, really looking forward to meeting everybody and seeing people. It'll be the first time I've seen the volunteers face to face. So we're looking forward to that. Some of our volunteers have refreshed and upskilled via online training opportunities. We've built a really good link via Youth Watch with Rochdale Young Carers Hub, and they're going to attend our January meeting. They've also been really, really good at sharing things through the WhatsApp groups to the carers and things as well for us. I attended the Freshers Week at Hopwood Hall Middleton. Our returnment volunteers between July and September, we've done really well with 114 hours volunteered. So that's with a variety of different things. We're still in attendance, raising awareness of volunteering and stuff at the VSAN, the Grassroots Economic Support Network, Family Grassroots, Women's Network. We're really, really keen to try and spread the word of volunteering with Health Watch as far as we can. Really exciting, we've got a social media volunteer who's just been recruited to help with social media reach and engagement. And also we've continued to do a lot of participation in questionnaires, surveys and consultations virtually. So it's still doing quite a few bits online, but looking into the next quarter, a lot more will be face-to-face and on the ground. And I think that was my last one. Is that my last one, Kate? Oh, our next steps. So as I said before, we're looking for a second round of recruitment for the Rochdale and Oldham Maternity Voices. So we want to continue to get some volunteers who are passionate about maternity service, who can both represent and reach out to local women, birthing people and their families from across both boroughs. The Youth Watch recruitment for membership sign-ups continuous and building links for monthly engagement. So we're really are keen to get on the ground in these schools and educational establishments now, and they're welcoming us. So it's really exciting. Again, we're looking at, because the Youth Watch was such a good way of doing the web form, Claire's looking at ways that we can alter our other application forms now for ease of use and look at gaps in representation for a wider targeting. We're going to do a volunteer survey as well, and also face-to-face meetup. So it's going to be quite an exciting next few months, I think. So thank you.
Thank you very much for that, Naomi. Very good update. I think that concludes the staff presentations. Any
Sorry,
questions,
Ben,
Naomi?
just a little update from me. There's not much to really cover. Just one last slide.
All right, okay.
So just a quarter two update from me, obviously, due to my absence with annual leave and ill health. And there's a few things that haven't been picked up, but just to give you an update in regards to the LCO and the future of the ICS across Greater Manchester. So I attended the LCO SMT, not last week, the week before, and we are looking at ways in which our data is going to go into the system and how we are going to work better together with our advisory group. So that is now all up and running. The local care organisation, which is the CCG and Rochdale Council, are due to go out around some engagement, which is around mandates, they're calling them, the NHS. And Health, I'm just in the process of finalising those mandates and how Health Watch will support this engagement around the system changes across the NHS that are coming. As you all know, we're looking at an office relocation. I attended an office viewing at the Esplanade in Rochdale, which was a really nice location, but a little bit pricey for what we're used to. So I am just waiting on the council to come back to me with their availability in local buildings and number 1 Riverside. So as soon as I've got a further update there, I will provide it. I delivered an advisory group development session at the beginning of July around our decision-making policy and how the advisory group is the bread and butter to what we're doing now, and looking at empowering the group to understand the policy and the strategy behind the work that we're doing. And then myself and Rob have been working on the Health Watch England quality framework development. And like I said previously, we've engaged with our board, staff and volunteers on this, and an action plan is now in place. So we're just in the process of finalising that action plan with Health Watch England to ensure that the quality framework is part and parcel of everything that we do at Health Watch. So that's just a quick update from me. Thank you.
Thanks very much, Kate. Any questions?
I've got a couple of questions on the volunteering side. Have we lost any volunteers that used to do interim views pre-COVID to today? Or do we still have those same volunteers? And approximately how many volunteers do we have?
Well, we've lost one, not as in like he's lost in transaction, is moved away. So we have we're one less from our interim views, but all the rest of them are still just waiting for the interim views to or they're interested, become interested in other areas, and stuff as well. Some have gone onto our advisory group. So we are just one down from our interim view, and then in general, I think we've got 18 volunteers in total, and that's not including Youth Watch and the Maternity Voices. So the Maternity Voices is 7 and the Youth Watch at the moment 7. So that's 18 or 14. My brain's not working to add up today, David. But yeah, it's so we're doing quite well. We've managed to do really well with retainment of volunteers throughout this last year. We did have 3 who left our advisory group, 2 went on to working full time, and another one left to do something else. So in general, they've moved on to do other things and not had the time capacity for volunteering.
I'll just I don't know if concern is the right word, but concerned that we might have lost them because we couldn't enter and view all of these residential homes across Rochdale, and we still can't in a way, and whether we've been able to hang on to them or not.
Yeah,
So we have all
yeah,
but one.
still waiting and raring to go. Yeah.
Yeah.
But they have been, they have attended Health Watch England enter and view training updates and things just to keep themselves in the loop and carry on, consistently. Because even just around some of the other health watches have implemented like Zoom enter and views in hospitals and things like that. But some of our other volunteers who do their enter and views, they're not online. They don't have online engagement whatsoever. So it's something that they weren't interested in doing anything online as such, but they have been upskilling themselves still by attending other things.
Right. Okay. Thanks.
Are we good to move on, Ben?
Yeah, sorry. Yeah, that's great. Thank you. Next agenda item, advisory group report updates.
Thanks, Ben. So I'm going to give a verbal update, and I apologise in advance. You will receive the minutes, action log and decision log after the meeting for the previous meetings for this quarter. So in regards to the advisory group, I'm going to go over and give a quick update, and then Karen Kelland, who's the chair of the advisory group, is on the call. So if I've missed anything, Karen's going to jump in and just give a quick update. So Rob's already mentioned the current issues in regards to the feedback, and they're obviously the issues that are filtered down to the advisory group. So they're what we're currently discussing around GPs. I've already alluded that we had a development session, which was back in July, and it was a really positive session. At the end of the session, there was 5 questions which were asked of advisory group members, and it was really just to see how responsive they think the group are, if it's working for them, how we can look at changing things. And people felt that the advisory group is working, and there's been so much development, and I think it's just strengthening the members and getting more people in now. During the development session, we discussed frequency of the meeting and how that's working operationally for us, as well as for the volunteers who attend the meeting. And we're going to look at changing the meetings to bi-monthly meetings instead of monthly meetings. And we're really working on how we're going to feed that up and how our data is going to be fed into the system to make sure that quality improvements is coming off the back of patient experience. So in regards to recruitment and membership, obviously now I always give you a quick update there. We are looking at recruiting more people, the more the merrier. And in regards to our membership, for our current membership, we do have some really good linkage in regards to back into the local communities. So, for example, 3 of our members are linked to organisations as well. So we have organisations linked to Better Health Middleton, Bridging Communities, and the Aqua Lived Experience panel as well. So it's all about that, reviewing information, sharing of information, digesting and passing that on, which is really good around our membership. So I mentioned about me going to the LCO and giving a presentation, and that was specifically around our decision making. And that's what our development session in July was based around for the advisory group, stripping down the new policy was approved in April by the board, and really looking at what decisions are made and how they're made and what's the right way to go, and also in what time frame to do so through the escalations. And we're looking at how, in regards to that local LCO development, the advisory group can be have more of an oversight of the work around the local NHS mandates that are coming through. The partnership working within Health Watch and with the advisory group continues through the Together Rochdale and us attending the grassroots gatherings and various voluntary sector meetings. So our partnership working is still key, and we have regular updates from various commissioners and providers coming to the advisory group to provide members with information on services that are out there. So in regards to impact and decision making, like I said, we have a session on the development session on the decision making, but something that me and Karen are really keen to start showing, Joe Public, the board, everyone really, is the impact that we're making. And we want to start doing that, through tracking the information that's being picked up via Rob and the impact tracker, and really showing people every quarter what difference we've made, whether that be, a bigger change in service or an individual support basis. So that's an area where we really want to start developing and making sure that we're reporting and holding people to account on. So thinking about what's next for the advisory group, a buddy system. So we want to look at when we bring new recruits in to provide them with a buddy system, and whether that be with staff members or existing advisory group members, just to offer them that support. Thinking about how the advisory group members are supported as volunteers, and that contact from Karen as the existing chair, not necessarily one-to-ones, but information sharing and how frequently we do that. So what works best for the members, that's what we need to go out and ask. So we spoke about Youth Watch a lot, and obviously some of the information that Naomi's give us around what the information the youth are telling us, and what we need to work on is how we develop that link between that Youth Watch voice and the advisory group, and whether that's asking whether the young members to attend on a regular basis. Obviously the information needs to start being pulled through the data report, but we just need to start correlating that information to make sure that youth voice is coming through in every report that we're creating on a monthly basis. So back in November 2020, we did a 360 stakeholder event, which was a physical event, which people attended at KYP. And on the back of that event, we asked all attendees to sign up to a pledge for us, to support us, and for them to pledge how they could support us as an organisation. So come after Christmas, what we want to do is we want to review those pledges and recontact the organisations now, things are a bit more normal, and hold them to account on those pledges and see how we can they can offer us the support that they did at the time. And then just finally, in regards to the terms of reference for the advisory group, just to let the board know that they will need to come back for full board approval, because they'll be amended around the frequencies of the meeting. But other than that, the meetings have been really positive. Attendance is good. Issues are coming through, and obviously from the information you've received from the presentation around the data sets that we're getting are there. So there is a lot of information for us to be stripping back and trying to deep dive into. So I'm going to stop waffling for now. Karen, I don't know if there was anything else that you wanted to come in with there.
No, just to look at the range of issues that do come through the advisory group. I don't know whether normally that's listed for us in the report if we did a hard copy report, or whether that goes elsewhere. Whether the board do want some idea of the kind of issues that are coming through and that we're dealing with, and where we said about the tracker, but we've also had an issue, I think, go to the CQC. So is that the kind of information that the board wants, and is that in future what you want to see in the report?
Yeah, so just come in there, Karen. Normally that would be in a written report. All that information would be in there. It's just been due to my annual leave that report's not been finalised, and it normally sit with Tracey. So normally that information would come in there, but I think the information is very much duplicated in regards to Rob's impact tracker in some ways as well, because everything that's filtered through the organisation, it's all the same data set.
Yeah. Okay.
So what Rob's reported on the impact that we've made, and in regards to the issues that are coming through, that's the same stuff as the advisory group.
Yeah. Okay. Thanks.
Okay. Any more questions for Karen or Kate on that? No. Okay. Getting a lot of feedback. Cheers, thank you. Any other items of business? I've had none notified in advance. Kate, have you had anything? No? Excellent stuff. All right, so date of the next meeting, December the 21st, 2 o'clock. Hopefully we'll have a new chair in by then, but we'll have to see. So we'll go straight to the next meeting, unless anyone wants just to have a cup of tea or something.
If we say we log on for 3 o'clock, then is that all right?
Yeah, that's fine by me. That gives us 10 minutes. Yeah. Is everyone happy with that? Yeah, excellent. All right, I'll see you at 3 o'clock on Teams. Thank you, everyone, for joining the public section of the meeting. Thank you. Bye.
Bye-bye.
Thanks, everyone. Bye.
Rob, can you stay on?
We're still live on YouTube.